So, Reg, the years that you served as executive director were, I think, a pretty tumultuous time for family medicine education and for medical education generally. And I'll kind of ask you to maybe talk about 4 different things that came together to create an interesting time, as the Chinese might say. So first was, during the 80s, the Canadian Medical Association established 2 task forces, the Wilson Task Force and the Cox Task Force. And their task was to look at preparation for training in general practice. And I think that at the time there was certainly elements within the CMA that wanted to see family medicine education criticized and perhaps abandoned as the route to practice. As those reports were coming to their conclusion, the Medical Council of Canada also threw a kind of curve at the college with the development of the Part 2 examination for the Medical Council Licentiate, which was an OSCE exam to assess general clinical skills, which was really a bit of a challenge to our certification exam, which also assessed general clinical skills. At the same time, Behrer and Stoddard released a report looking at medical human resources within Canada and arguing that we had too many physicians and that we needed to look at alternative healthcare professionals to provide healthcare to Canadians and cut back on the number of physicians that were being trained. And finally, partly as a result of the CMA reports, which ultimately were very favorable to family medicine education, we ended the junior rotating internship. And when that happened, in favor of family medicine residency, those positions were lost rather than transferred to family medicine residency training, which affected the total number of people entering general practice at the time. So a number of unrelated things happened and had a tremendous impact on the college. I just wondered if you could reflect a little bit on that period of time and how your view of what happened.
Well, you're quite right. It was a very tumultuous time. The Wilson-Cox reports were interesting, and they were around for quite a while. And it seemed that at that point, as the College of Family Physicians, we were going in a different direction from many of the other organizations in the country that were involved in medical education. We were working on making our certification better and better every year, and it was getting better. It was attracting more graduates. And our long-term goal, of course, was to make the certification in family medicine the standard to become licensed to be a family doctor in Canada. And this was simply following the pattern of the Royal College. I mean, to be a licensed surgeon or obstetrician or any other consultant specialist in Canada, you had to get your certification fellowship from the Royal College of Physicians and Surgeons of Canada, so that it was a pattern that was already there. It wasn't something that we invented, but we were trying to bring the standard of family medicine up to what we observed to be the standard in other disciplines in medicine in our country. And then there was this countermanding force of those that felt that they wanted just to keep the junior rotating internship, and that after that people would get licensed and go out and be a GP or be a family doctor. And we felt that since that was mostly in hospital training and didn't have many components that were important for family physicians to learn, that in the long run was inappropriate. Going back to what I said earlier in this interview, it was the same kind of feeling I had when I did my rotating internship and wanted to be a family doctor and felt I needed an extra year of training, and did get that extra year of training before I went into practice. So we felt that our 2-year family medicine residency program was modest in its length, but still was capable of achieving the objectives to make family physician training appropriate for this country and the patients that they served. So that was where we were at, and it brought us together very strongly with the other medical organizations in Canada, which fortunately in the years prior to that we had established good working relationships with. So we had good contacts and were able to negotiate with them. We didn't always win, of course, but we kept at it, and ultimately what we wanted to achieve was achieved for family medicine and the certification exam and its equivalency to being licensed as a family doctor. But it was pretty rough and tumble along the way. And then, of course, along came the Barrett-Stoddard report, and that was probably one of the most difficult times for me as the executive director of the college, because we felt that their numbers were not accurate in terms of the doctors that were actually practicing and delivering care to the patients of Canada. And the federal government had commissioned the report, and I think were anxious to be able to reduce the number of undergraduate medical students and postgraduate training positions for the usual government reasons. And so we set out in cooperation with the Royal College and the Canadian Medical Association, the Association of Canadian Medical Colleges, to do our own manpower study coast to coast. But we did it differently. We made sure that we counted only doctors that were actually providing patient care, not doing something else. And also we converted to full-time equivalents. And we came out with numbers that were considerably lower than what Barrett-Stoddard had reported. And then we tried very hard to get the attention of the government officials and the public to our point of view, to show them that we felt that the proposed 10% reduction of medical student population and the 10% reduction in the number of residency positions available was not a good idea and would actually result in doctor shortage in Canada. And then, as you mentioned, the compounding factor came along when the government, well, first of all, we were unsuccessful there. We tried very hard, but we went to meetings and we tried to attract the public's interest in the problem, but we just did not succeed. So the government went ahead and put that in place in the early 1990s, and that happened. And as you mentioned, the other compounding problem was that the rotating internship positions were lost to family medicine. So here we were having to fund trainees for a 2-year residency program with less dollars than we had before. And so that had led to a definite shortage of family doctors in Canada, and actually that went on for about 20 years. And the evidence for that is the many public reports in the news and in the newspapers of the fact that many patients in Canada could not find a family doctor. So we had to live with that family doctor shortage for that lengthy period of time. So it was that was a difficult time. There were other things going on as well. We were trying to work out a deal with the American Board of Family Practice to get proper transference of qualifications between our two countries, with people trained in U.S. and trained in Canada could also be licensed in either country. And we were successful in achieving that as well. And as I say, eventually it all worked out, but it was a rocky road to get there.